Hey guys, this is Chelsea Perry with our long-term project submission for our clinical advocacy in underserved areas class. I chose to do my project on mental health in rural communities. I chose this because I have struggled with mental health issues at different times throughout my life. And then I also currently work in a rural area in a mental health field. So I just kind of felt like that was fitting. So when working in rural communities, especially with mental health, there are different kinds of challenges that arise. One of the challenges that arise is the scarcity of professionals. There are not a lot of professionals to go around and or enough professionals within that rural community to provide the necessary services. And I found that in our textbook chapter 1, as well as the transportation issues, because there's not a lot of public transportation, or a lot of people don't have reliable cars to get back and forth so many miles just to be seen. And then also in chapter 1 of our textbook, I also found the access to the mental health clinics. So for rural areas, there's not a lot of mental health clinics. There may be like 1 or 2 mental health clinics per county. And just so you guys know, all of these pictures that are in the slides are part of Greene County, Tennessee, because that's currently where I work. I work in Greenville. So if you see any of the pictures, that's what they are from. And then also, the stigma around asking for help is a big challenge. The article from Humble that we talked about, that we had to read for week 5, it provided a lot of really useful information about stigma, about how people are scared to ask for help, because especially in rural communities, because they're afraid of being noticed. That they're scared because people will know their business. And then I threw insurance coverage in there as well, because a lot of rural people, they either don't have health insurance or they don't have good health insurance. And so they're very limited, if they do have health insurance, about where they can go based on what their insurance will pay for. And if they don't, if they go somewhere, they have to pay out of pocket. And so hopefully the clinic that they would go to would have a sliding scale to maybe help with that, or maybe payment plans. But those are few and far between. And so like I said, I chose to do Greene County, talking specifically about that area, and working with mental health in Greenville. So according to Daily, 18.21% of the U.S. population is made up of rural communities. Greene County, Tennessee, is one of those rural communities. It is made up of 15,614 residents, spanning 624 square miles. And within that, there are, I think, 3 mental health clinics, but 2 of them are not very good. That's my personal opinion. And then one of them is decent. But as far as reliable and good mental health clinics, the residents of Greene County would have to drive more towards Johnson City or even Kingsport, which is over an hour. So the population that makes up Greenville is 88.2% white, 2.9% Black or African American, 0.7% American Indian or Alaska Native, 0.4% Asian, 0.2% Native Hawaiian and other Pacific Islander. There's 6.5% who have two or more races. And then if you're Hispanic or Latino, there's a 5% chance. And all of those statistics came from the U.S. Census Bureau. So mental health is already hard for rural communities, and it's even harder if you're a minority. So again, minorities in this community, everyone is predominantly white. So it makes it that much harder if you're a minority to one, even ask for mental help. But for minorities, it's even harder to actually get the help. And then within that, say you're a minority and you're a part of the LGBTQIA plus community, then it's even more hard because now on top of being a minority in a predominantly white community, you're the underdog because you are a minority, and now you're also part of this community, which is already frowned upon. And so these are just some statistics that I found from the ruralhealthinfo.org. So in 2020, a report from the CDC from 2000 to 2018, the rural suicide rate increased from 48%, while urban rates increased by 34%. In 2018, the suicide rate in rural counties was 19.4 deaths per 100,000, compared to urban counties with 13.4 per 100,000. And I would just like to advocate on that. I specifically have known, I've known two people who have committed suicide that live within my rural working region. Just in the last, I've only been working in a rural region for like 4 months. And so knowing that there's already been two, that's absolutely heartbreaking that rural residents don't have access or the ability to get the mental help they need. From that same article from Rural Health, results from the 2022 National Survey on Drug Use and Health, detailed tables, approximately 7.7 million non-metropolitan adults reported having any mental illness in 2022, which accounts for 23% of non-metropolitan adults. In addition, 1.9 million, or 5.7% of adults in non-metropolitan areas reported having serious thoughts of suicide during that year. And that volume speaks for itself. That 23% of adults have suffered thoughts of suicide because they're not able to get the mental help that they need. And it's just kind of really, really heartbreaking. And then the last statistic from that article is that as of September 30th, 2021, the HRSA has designated 3,426 mental health professional shortage areas in rural areas. It is estimated that it would take 1,597 practitioners to remove the designations. And for those of you who don't know, the HRSA is Health Resources and Services Administration. And so that just goes to show that we are in the middle of a mental health crisis that there is not enough available in rural areas. Even sometimes there's not even enough in urban or suburban areas. So it's just heartbreaking to know that we're very much, mental health professionals are very much needed, but we're very understaffed. So some social challenges that arise when, again, working with rural communities. So one challenge is the access that they have. So rural residents have to travel farther than their urban counterparts to access not just mental health, but any healthcare services. They may have to travel especially for specialties, they may have to travel to larger cities, which can take up to maybe an hour or more to drive to get those services. Again, there's that lack of public transportation, and limited access to private transportation. So again, I've already said it, but people have a hard time keeping a reliable vehicle. Some people don't have driver's license. They don't have money to put fuel in to go to therapy twice a month if they're driving an hour there and back, because that's 2 hours. For some people, that's like a full tank of gas. And some people just don't have the time, because by the time they would get off work and you drive an hour, the place would already be closed. And then sometimes you have one clinic for a relatively large area, which means that they're less likely to take new clients because they might already have their max amount of patients or clients that they could see due to serving such a large area. So to me, it kind of views itself as a first come, first served basis. And also because of that healthcare provider shortage, there may not be enough therapists in that office, or mental health, not just therapists, but any mental health professional. So that can include psychiatric nurse practitioners, psychologists, people of that sort. And then, again, many rural residents do not have access to mental health services due to having no insurance, or the insurance that they carry is not accepted at the clinic, and things like that. And then also you have that stigma. So again, we've already talked a little bit about stigma, but there are many people who will not seek help due to the stigma that surrounds mental health. I know growing up, I grew up in the Bible Belt, and so people thought that as long as I went to church and I loved God, that I shouldn't have mental health problems. But I did. I struggled, and I still do struggle. I currently do therapy once a month. And so, but I have learned that the religious stigma that can come from it is due to people not understanding. And that may be because when our grandparents were younger and they quote unquote didn't have these issues, no, they were there, they just didn't know how to address them. But that religious stigma that surrounds it, I have learned that it is okay to love Jesus and have a therapist. So some ways to help the mental health in rural areas moving forward. One of those is availability. So we should try to expand rural mental health care provider availability through recruitment and retention strategies. And some ways that we can do that is we could offer stipends and or paid internships for students toward mental health and human service degrees. I think that would be very beneficial because it would give students a look into the community, but it would also help the community by having more resources available. Within the availability, we could also increase the eligibility criteria for national and state loan repayment programs to include bachelor level social workers, health and human service providers, certified drug and alcohol counselors, and expand the service delivery location sites to include home, school, and community-based settings. So within that, I think it would be a good idea to maybe if you're in a rural community, I would like to see one day, like, have a designated day and time that you're with that, like, within a certain part of a community. So say you're, for Greenville, you span 624 miles. Say, okay, I'm going to be in South Greene County today through Wednesday. So you would do and you could meet at a community place or somewhere like that and get all your services done in one day. And do that every couple weeks. And then also for availability, we can offer advanced incentives for providers who practice in rural settings. I think that would be a good opportunity for people to actually get to work in rural settings, but also to be like, okay, well, if you're going to pay me good, I'll come. And then another way to help is to increase access to quality, culturally responsive rural mental health care services across the nation. So some ways that could look is to co-locate mental and substance use treatment with physical health services, maybe at hospitals, so that way you can help provide support, and you also get that interprofessional coordination and collaboration that you might need. So you could get the doctor visit and do a mental health service day while they're at the hospital. And then another idea is to expand reimbursement for mental health and suicide prevention. One that I think of when that's specifically tailored to my job is the youth mental health first aid. So maybe if you work with any youth in a rural area, youth mental health first aid, it covers topics such as suicide prevention, and things like that. And then for access, we could also fund services provided in non-traditional settings such as schools, community centers, libraries. Really, the possibilities are endless. So again, fund programs through schools, and things like that. And then for access, I think the biggest one is to give options of in-person or home-based services. So offer in-person if they need it. But I think a home-based service, specifically telemed. Telemed really came about more so when COVID hit, and it became a really good way for clients to still be seen by their therapist, and things like that, while being safe in their own home. And then the last one to help move forward is acceptability. So we as social workers or health service workers need to help support the creation and the initiation of social media campaigns. So that's a big thing. Social media is how people communicate now. So making those things to get the word out. Within that, we could also offer webinars, podcasts, chats that are specifically focused on rural mental health. And then also to acceptability to help with that is to generate and distribute educational materials at different community sites. So maybe setting one up at the community center, or setting one up at local schools. You could even go as far as to, if it was a school setting, you could even go as far as to send a flyer home in the child's backpack or something like that. But I just think that those would be good ideas. And so one thing to remember is when working with rural communities and rural clients, especially with mental health, is remember to stay culturally competent. In one of my articles, it listed the 4 A's. One is accessibility. So again, do these clients have appropriate transportation? How far are they having to drive? Like I said, for Greenville, they have to drive a pretty good distance. And even then, some specialty services aren't offered in Greenville. I know, for example, one of my kids that I work with at Holston Home for Children, they needed some sexually focused trauma therapy, and no mental health centers around us offered it. So we had to drive 45 minutes away from Greenville to go to Morristown. And then again, availability. Are there enough providers? Obviously we're in a mental health provider crisis, so there's not going to be enough providers. I don't think there ever will be. And then remember that affordability. So at the clinic or wherever they're going, is their insurance accepted? Is there a sliding scale for insurances that aren't accepted? I've seen that a lot. Right next to Holston, where I work, there is Frontier Health's NOLA Chucky, and they don't take a whole lot of outsider insurances, but they do have that sliding scale. So that's nice that you do have insurance, but it doesn't cover Frontier Health, but they do that sliding scale. Or are you paying out of pocket? And then again, acceptability. What stigma is there to overcome? So mental health is super important for everybody. Taking care of yourself is very, very important, and oftentimes it is overlooked in rural communities. So those are my references. Please obviously, we have the daily one because of our textbook and the Humble one. But feel free to look at the other 3. Thank you.